Guys, gals, listen. Insurance companies make billions of dollars. They make literal bank. So had a really good conversation today with a friend, and really around this idea of what I'm doing in this regenerative medicine space and why I am going against the grain with the insurance model when everybody has insurance. So why not just accept insurance and do, the things that insurance covers and that type of stuff. And so I just wanted to film this because I think this is really important discussions that we need to have, not so that you can come see me, but more so that we can figure out what the hell is going on with this insurance system and just talk through where those issues are, when it might actually be beneficial, and all that stuff. So I'll preface off, I'm just going to sit down here. I'll preface off a few things first. So I don't accept insurance. That has been pretty clear on a lot of my videos. And one of the criticisms that I've received in the past is, oh, well, you don't accept insurance because insurance doesn't accept you and the things that you do. And yeah, that's actually part of the reason. So the therapies that I do, the regenerative injection therapies, perineural, prolotherapy, nerve hydrodissection, PRP, autologous stem cell therapy, all that type of stuff is not covered by insurance. Whoa. And that is not because they're not effective. It's just that they have not been adopted into the insurance model. Will they at some point? Yeah, they most likely will. Although prolotherapy, for those of you who don't know, has actually been around for about 50 years now, and it's still not in the insurance model. So I don't know if that will, but PRP likely at some point, and autologous stem cell therapy. Well, stem cell therapy, it might be allogeneic stem cells that are being cultured from donors and things like that, and gone through as basically biological drugs. That will likely at some point. But here's the other issue with that is, and this is going to kind of segue into our insurance discussion. Insurance covers procedures for indicated conditions. So, for example, right now there are certain conditions that steroid injections are covered for, and if it's not one of those conditions, then you're unlikely to, the insurance is not going to cover that. The same thing will happen with PRP. So for example, PRP might get approved for knee osteoarthritis. But if you have a rotator cuff tear, or you have an ankle ligament tear, like your ATFL or something like that, then insurance is not going to cover the PRP. So it's not that it's not that insurance is just going to cover PRP for whatever people want to use it for. It's that insurance is going to cover PRP for an indicated thing. And part of the problem with that is the insurance model, because a lot of the allopathic model just views something like knee osteoarthritis as it's just an issue with the cartilage. You just have to inject something inside of the cartilage, and that's going to resolve everything because that's what osteoarthritis is. When kinda, but also at the same time, the pain that comes from an osteoarthritic knee is not always just from the cartilage and the what's called subchondral bone. It's actually, a lot of it can come from the fat pad that's around the joint, technically within the joint. It can come from the ligaments, the tendons, the nerves. There is a lot of stuff going on that can cause pain with osteoarthritis of the knee that is not addressed by putting something inside of a joint, whether it's a steroid, whether it's hyaluronic acid, whether it is stem cells, PRP. It doesn't matter. If you put something in a joint and that's not where the pain's coming from, it doesn't matter what you put in the joint, it's not going to help. And so that's my little segue on, the insurance aspect of why we, even if insurance covers it, it's still going to be a problem. Because in reality, if insurance starts to cover PRP, I'm not going to take insurance. Because again, I will be handcuffed. You can only see one hand because I got my other hand holding my phone, but I'll be handcuffed into saying you can only use PRP for this condition. And that sucks. That sucks for me. That sucks for the patient. The only person at the end of the day it truly benefits, which is a loaded statement, is the insurance companies, right? They're collecting your premiums. They are collecting your copays. They are collecting your deductibles. And they are making bank. Guys, gals, listen. Insurance companies make billions of dollars. They make literal bank. Please tell me why you are okay with putting money into the pockets of an insurance company and putting money into the pockets of a doctor. Now, rightfully, you should be putting money into the pockets of a doctor. If a doctor provides you a service that helps you heal, helps you find a diagnosis, saves your life, whatever it is, whatever service they do, they provide this service. They deserve to be paid. You know who doesn't deserve to be paid? Insurance companies. What did they do for you? What did they do? They took your money and then gave you access to health care. It's a smart business model for them, but real shitty for all of us, okay? So it is just ludicrous that we have this notion. Now, yes, I understand that insurance has saved people from going bankrupt. On the other hand, there are still people who have gone bankrupt even with having insurance. And filing for bankruptcy due to medical reasons is actually one of the number one reasons why people file for bankruptcy. So if this insurance system is so great, why is it causing us Americans to have to file for bankruptcy? It just doesn't make sense. You don't see insurance companies going under because not enough people had medical conditions that needed treatment. No. Their profits every quarter are going up. They're making bank, guys. We have to wake up to this. So that being said, I do want to say that there are instances when insurance is phenomenal. And I believe that it is phenomenal for those life or death situations where you are, you're in a really bad car accident or something, and it's either you have a surgery that saves your life or you die, right? The smart thing is, if you have catastrophic insurance, that's a really good thing. So there are benefits to it, and there are some good things. And I'm not saying that the system is totally off the rocker and that we just need to get rid of it. But the reality is that there is a better way to do things. I don't know what that way is, but there is a better way to do things in the chronic disease world, the chronic pain world. And so that is one of the main reasons why I do not accept insurance, is because I do not and will not ever have somebody tell me what I can and can't do, in regards to a medical treatment to help my patient. Now, I do not walk around telling patients that things are FDA approved or that insurance covers them or anything to that effect. I'm always very upfront with my patients on what the research shows, what my clinical experience has shown for particular conditions. And it's always honest and transparent. Why? Because I care about my reputation. I don't want my reputation to be smeared because I was talking my mouth about how great this is and it cures everything and all this type of stuff, because that's not true. These are medical procedures. They have a success and a failure rate. And so that needs to be discussed with patients, and always is discussed with patients. And patients know that there are failures. No matter how well we do something, how right we think we are, nothing is 100% in medicine. And so I don't know where I was going with that tangent, but bringing it back in here. I know. I was saying that I do not want to be handcuffed and told what I can and can't do for my patients. So if you are here close to 10 minutes into this video and you're still here and you are sick and tired of the insurance system and you are looking for alternatives to the insurance model, you don't want steroid injections anymore, physical therapy is not working, you do not want to take the pain meds that the doctors have prescribed you, you've either had surgery and failed or you don't want to have surgery at all. There are other options out there for you, things like perineural, prolotherapy, nerve hydrodissection, PRP, autologous stem cell therapy. what you have to do is you have to find a doctor who is willing to put in the work on that area, in those areas, to be able to provide you that service and work outside the insurance system. And you have to understand that you might have to save your pennies in order to do so. You might have to make sacrifices. If you're this far in the video, I'm going to be real blunt here. A lot of you are not willing to make the sacrifices that are required to financially afford things that could get you out of chronic pain. A lot of people will say that they can't afford something, yet they don't have a written budget. They don't actually track where their money goes. So in reality, their money could be going left, right, nowhere, because they're just wasting a whole bunch of stuff because they don't have a written plan. And so if anybody's curious, I'm a huge fan, and my wife and I are actually following and doing Dave Ramsey's baby steps. And that has really, helped us to sit down and get into the habit of knowing where our money's going and financially planning. Because guess what? We are prioritizing buying a home. Oh my God, what happens when you prioritize money and saving for something? You save for it. If you prioritize something, you save for it. If you say, I have had enough of this steroid injections, surgery, all this type of stuff, because it's not working for you. And I'm not saying it can't work for anybody, because it does work for some people. What I'm saying is, if it's not working for you, the person watching this video, and you are sick and tired of it, and you want outside options, you have to financially prioritize. If you're currently not just available to do that, and you have to go through that and save and talk with doctors and be willing to put in the work on all aspects in order to heal. That's just what it is. So if you are, here it is. If you are sick and tired of the insurance system and you want to work with a doctor who is absolutely passionate about regenerative medicine and helping you to get out of chronic pain without having to have surgery, steroids, none of that stuff, I would personally love to help you with different regenerative injection methods, prolotherapy, PRP, autologous stem cell therapy, perineural injections, nerve hydrodissection, you name it. These are things that I obsess about and want to share with all of you so that I can help you to heal from your chronic pain. Thanks for listening, everybody. If you made it through the end here, you are the best. I love you all.